Hey YouTube, hi Spotify, it's Kel, and I am following up today with a new video, a second in the series we're doing a series on substances. And today we're going to talk briefly about stimulants. So we talked in the first video about looking at substances and substance use from a nervous system perspective and also trying to understand the dual diagnosis aspect of substances, how usually if there is substance use going on, there is an underlying emotional issue that people are typically trying to avoid or escape by using substances in order to regulate themselves or self-medicate whatever that emotional issue is. And I mentioned before, it could either be depression, it can be anxiety, and by the way, my cats are joining us like they normally do. So baby. And so um, but so it could be depression, anxiety, again, trauma. Trauma is an anxiety disorder, but obviously it can include depression. It can be, a lot. It can be grief. Just so there's a whole bunch of different things that could be underlying the drug, you know, uh issue, the substance issue, which is why it's difficult to do videos like this. So I'm really going to try to keep them very simplistic, because uh drug use and abuse can be so case specific. But today we're just briefly going to talk about stimulants. Again, everybody's had a health class, so I think a lot of people know some of the stuff I'm going to talk about when I talk briefly about just the class of stimulants. And also we're going to talk about relaxants or depressants in the next video. But so you'll know kind of these things of like basic, what is the gist of what are the drugs in each category. And then we're also going to do a video on the root causes of drug use typically. And then maybe my final video, I think, is going to be something along the lines of treatment interventions, or what can you do, if you or someone you know is suffering from drug use. And of course, it's going to be very general. Any good therapist knows that every treatment plan should be adjusted to a specific person. So of course we can't do that in a video like this, but I will just be talking about kind of the general gist of what most treatment for people looks like, the basics, and then it's tailored along the lines of what each person is dealing with. So we'll get into that in future videos, but just today we're just going to talk briefly about stimulants. So we mentioned how a lot of times people can be drawn to stimulants for a couple reasons. So first of all, I'm going to list what are stimulants. So what are the common ones that you may know? And so the one of the major ones obviously is cocaine. That's not seemingly as common as it used to be, and I think that's because of the rise of methamphetamine has become a cheaper alternative, and it also is a very powerful stimulant depending on how pure it is. And so, but it used to be very, very common, cocaine. I mean, you know, as common as, drugs, street drugs are going to be, but and again, I think it's died down a little bit. And then methamphetamine has grown in popularity, especially throughout like certain regions in the United States that struggle with it more. But and then so you have cocaine as a category of stimulants, you have methamphetamine as a category of stimulants, you also have amphetamines, which is like a cousin of methamphetamine. And then you have ADHD meds, which are also, I believe, at least some of them are a type of amphetamine. And then you also had the everyday stimulants. And like I said, I drink coffee, which caffeine is a stimulant. And then also sometimes nicotine, depending on how you use it and the extent to which it's used and how much is used, etc., can be also a stimulant. So now, why do people use these? Okay, I'm going to list when I was working in treatment centers, I would always ask my clients what made you like your drug of choice, the stimulants. If you wanted to use stimulants, what was the draw to them? And these are the answers typically that I was given. Energy was the biggest one. It gave me more energy. It also, what I have heard is it gives people motivation. And this is because depending on the drug, it can definitely stimulate the release of excess or increased dopamine to be released in your brain, which is going to motivate you more. It also can release norepinephrine, which is adrenaline. So that is the stimulant that you're feeling in your body, or the quote alertness. And then along with that is you get an increase in focus and concentration, mental clarity. Some people use it for athletic performances, depending on, the drug. And then, so now what I want to talk about are the downsides, or what did I see the most in people who because at first, I have a friend who actually was an addict. She's also became a licensed marriage and family therapist, and she was very wise, and she would say, drugs are always the solution for people until they become the problem. What does she mean by that? Well, she means that, like, when people start using the drug, whatever it is, solved some kind of problem in their life, or they wouldn't start using it, and so they were looking to escape or feel better or whatever. And so it started off as a solution until it became a problem. And so how do stimulants end up causing problems in people's lives? Obviously, we're gonna, over time, any drug use or abuse typically causes financial issues in someone's life unless they have a ton of money. But that's one of the consequences, is just increased dependence can lead to, increased financial risk of paying more and more for the drug that you need, right? Um, that's not the biggest one. The biggest one is long-term, specifically for stimulants, long-term dependence and exhaustion in your body. So, you know, you can imagine if you are staying up, or you're pushing your body to its max, and you're not sleeping, you're not getting the rest that it needs. And and you have your sympathetic nervous system, which is, when you're under the stress response, your sympathetic nervous system is activated. And that is when you take a stimulant, it's the sympathetic nervous system that is increased. And what happens is you are inhibiting the parasympathetic nervous system. And so your parasympathetic nervous system is what is called like the rest and digest nervous system. And it is also the nervous system where body recovery is done. So when you are trying to repair your body in any way, it's done in that parasympathetic state. And so you can imagine, if you take a stimulant for a long period of time without letting your body equally go into the parasympathetic state and get enough sleep that you need, or get enough, rest, or have the downtime that you need, you are going to do long-term damage to your body, because your body's not going to recover from properly from the damage that you're doing to it every day when you push it to its limits. So, like, you can see this in, and I'm just, stereotyping, but with methamphetamine use, it does cause premature aging. You can see it in a lot of people who have actually used it consistently over time. It really does age you faster, because it stops your body from entering into that parasympathetic state where your rest and digest, where your body repairs itself. And so you're literally going days, weeks, months, years without going into any kind of repair state. And so, therefore, your body is just like pushed to the limit, pushed to the limit, pushed to the limit every single day. Now, I'm sure you're asking, why would a person do this? Well, it is because of that dopamine high. So, when you have dopamine increased in your brain, that's the pleasure chemical. And then when you have increased adrenaline does come with its own little rush. So a rush, and increased in mood, a little bit of euphoria. And so, it's the mood bump that these stimulants give that typically makes it very enticing, along with the fact that then people are so exhausted that they need these stimulants to then feel, quote, normal every day. So, it creates that long-term dependence. So you push your body into like a long-term exhaustive state when you continue to take them every day. The other really big thing I want to talk about is long-term use of stimulants like cocaine, like, well, obviously methamphetamine, but also even things like amphetamines or diet pills, or, um, you know, uh, even excessive caffeine or energy drinks, can actually, I've actually seen this with pre-workouts that people take, which can be stimulants in some, depending on the one you use, but can cause excess irritability in your relationships. And that's really important. And why, I have had multiple clients say to me in my, clinical practice, well, we never, ever, ever got physical, ever. We've never gotten physical except for the very few times that we have done cocaine. And so, and then they mixed cocaine with alcohol. So you're giving a stimulant, which is then, causing this crazy adrenaline release throughout your body, and it's causing increased irritability, which is your fight or flight's going to be increased. And then, as if you can remember from my videos before, then when you drink more, you're reducing your prefrontal cortex, so you're not making proper decisions. So you have increased fight or flight and reduced, prefrontal cortex use, and it is a recipe for domestic violence. So cocaine, methamphetamine use, especially when combined with alcohol, can be an absolute recipe for domestic violence. I've never been involved in domestic violence, but um, you know, I have heard it multiple times from multiple clients that they have never, never, never would be involved in anything, violent except when they have had stimulant drugs that they've used, specifically cocaine. And again, I've never tried it, but there is definitely a pattern here that I have heard from my clients, if they, especially cocaine, or if they've combined cocaine with alcohol, and stayed up for long hours or whatever, it has led to an episode of domestic violence. So that's very important to know, just because, domestic violence can be judged in and of itself, and that you should not take it lightly. However, I do think that in the context of drug use or stimulant use, you also do need to look at kind of what are the factors that were involved when, whatever, if any situation happened. Also, just strictly, even if there's no violence involved, increased irritability. I think you've probably known someone who is on, say they were dieting and they were on some kind of diet pill. I can almost guarantee you there was an increased level of irritability to some extent at some point in time, because again, that's what the, amphetamine like drugs do, is they increase your fight or flight. So it does give you more energy, but again, it's that fight or flight energy. So you are in like a survival mode. And along with that goes, you have like an adrenaline boost. So you're like more ready to fight, so which gives you increased irritability. So, um, I wanted to just, get on and share with you what my experience has been when I talk with people who have stimulant dependence. That would be, and what again, the underlying emotional disorder often accompanying stimulant dependence is depression, actually. So people have some kind of grief they're trying to avoid, some kind of loss, some kind of abandonment or betrayal, or and it has led to sadness and depression, and they're trying to boost themselves out of it and kind of avoid it, and so they're temporarily going into a pseudo heightened, pseudo happy state or whatever, trying to avoid that grief. Now, the joke is sadly on the person who uses the substances, because it's temporary, right? And then what happens is you're just avoiding the time that it's going to take to sit in those feelings and deal with the negative feelings, and then actually process them and hopefully move through them. But, if you the longer, the more you use a substance to avoid whatever feeling, the longer you're going to be carrying around that feeling underneath. So, and the more desperate you may get to use substances to avoid the feeling. So it's kind of like an avalanche, the longer you run from it, the bigger the feeling gets that you're trying to avoid. So, again, this is how long term I'm gonna do a huge shout out to AA probably every video, because that's so much how AA helps people, is it really lets people see and hear about talking about your raw feelings, whatever they are. And it says, like AA is very good at saying, hey, we are, people who are okay with being sad here. We're okay with being angry, irritable, frustrated, annoyed here. We're okay with, we don't have to be happy all the time. We don't have to be, anything all of the time. We can just be purely ourselves, and we are accepted here. And it's a great, amazing, accepting community like that. And it lets people communicate about difficult feelings, which for a lot of people, they have never learned how to do in their life. And so it's really, really incredible. But so I hope that this helped. Again, in the future videos, we're gonna get to root causes, of why people do drugs, and I gave you a hint already there, but I mean, the biggest real underlying thing is if you have a real substance use or misuse problem, there is usually some kind of underlying emotional pain you are trying to run from or escape, or, in yourself, and you're kinda not okay necessarily sitting in anger, irritability, frustration, sadness, anxiety, worry, shame. There can be just a lot of the underlying feelings underneath the surface, and real healing is about kind of getting into those and just saying, "Hey, I'm okay with feeling whatever feeling comes up, and it's going to suck, but it's going to pass, and I have to just feel it for it to, move through me." And maybe I can find some healthier coping skills to process these feelings and not, quote, drink them away or use them away or, distract myself from them. So, again, that's going to be in future videos. We'll talk about root causes and we'll talk about treatment interventions. But today, I just wanted to briefly talk about stimulant use and also kind of what are the downsides to why do people use them? Why do people see them as a solution? And then how does stimulant abuse turn into a problem? And again, a huge part of it is body exhaustion, long-term dependence on it, can cause health issues like heart issues and all of that. And then also just mood swings and irritability, which end up, affecting your relationships. So I hope that this helped. And again, there's going to be a series. Hope you stick around for it, and I will see you next time.